Hello, and thank you so much for joining me for this video. I'm really excited to watch this video. The real reason American healthcare is so expensive. Could it be because it's an essential service that is basically a monopoly to your local area? Like when you break your arm, you don't just get to say, okay, let me shop around and find the best price for a cast. No, you're just gonna go to the nearest hospital and they can charge you pretty much whatever they like. And combine that with the health insurance companies who are just middlemen who slap money on top of it to make a profit. Yeah, I can imagine why it's so expensive. But here's the real reason. I'm sure there's a lot more to it too. In America specifically, well, America doesn't provide healthcare to its citizens. So that doesn't help either.
I cannot tell you how obsessed I am with this chart. It shows exactly what is wrong with America's conversation about healthcare. On one level, you've seen this chart before. It shows healthcare spending as a share of the economy of a bunch of countries. There's Germany and France and Japan and Canada and oh, there's America. But now I want to add something you haven't seen to this chart. This is how much of that spending in each country is private and how much is public. Here's what's amazing.
Very interesting. Really interesting. Honestly, I'm surprised the public is that high in America. So I guess that's like Medicare and Medicaid.
What's amazing? America's government spending on healthcare, on programs like Medicaid and Medicare and the VA, our versions of socialized medicine, it's about the same size as these other countries.
That is actually remarkable.
These countries where the government runs the whole healthcare system. And then there's our private spending. It's the private insurance system that makes healthcare in America so expensive. Conventional wisdom says the government is more expensive than the private sector. It can't say no, it's corrupt, it's inefficient.
I'm still thinking about this chart. Like, this is actually kind of mind-blowing. I'll skip back to where I was, but the fact that we're spending this much, is this per capita? Like, as a share of GDP, we're spending this much on only the people who use Medicare and Medicaid. How is that even possible? It's like, what percent of the population even is this? We're spending as much as every other country, and yet it's only for like 15% of the population, 20% less. I don't know, something around there.
It runs the whole healthcare system. And then there's our private spending. It says the government is more expensive than the private sector. It can't say no, it's corrupt, it's inefficient, it's slow. You want something done right, you give it to the private sector. That is what we hear in America all the time. And yet here we are with the biggest private sector spending.
And honestly, it's kind of true too. Like, I see both sides because the government does suck. At least here in America, they're totally incompetent. And it's like everything they do is pretty trash and they spend way too much money on it. But at least taking away the monopolistic aspect of it and the profit aspect surely would help.
Spending the most. Why is a free market so bad at controlling the cost of healthcare in the United States? If you look at the data,
I mean, they don't even tell you. If you're not American, they don't even tell you when you go to the hospital. They'll just start giving you things. They'll say, oh, do you want this? Do you want that? Here's a treat. I think you should get this treatment. If you ask how much does it cost, they don't even know. They act like that's a weird question. Why are you asking that? You know, sometimes they won't even tell you, even if you do ask. And if they do tell you, it's like they got to get a hold of their whatever department, and nobody knows.
On physician visits and hospital discharges, you can get rid of one theory. Americans don't consume more healthcare than people in these other countries. We don't go to the doctor more than the Germans or the Japanese. In fact, we go to the doctor less.
Yeah, because it costs an arm and a leg.
The difference between us and them is that we pay more. Every time we go to the doctor for everything from an angioplasty to a hip replacement, from a C-section to a pain reliever.
A pain reliever. $265. It's so insulting.
In America, the price for the same procedure at the same hospital, it varies enormously depending on who is footing the bill. The price for someone with public insurance, like Medicare or Medicaid, is often the lowest price. These groups, they cover so many people.
What does that even mean? How does the price at the same hospital change?
That the government can demand lower prices from hospitals and doctors, and they get
This makes me kind of mad, guys.
those lower prices. If the doctors and hospitals say no, they lose a ton of business. They lose all those people on Medicare, all those people on Medicaid. But there are hundreds of private insurance companies, and they each cover far fewer people than a Medicare or a Medicaid. And each one has to negotiate prices with hospitals and doctors on their own. And if you're uninsured, you have even less leverage. Nobody is negotiating on your behalf. So you end up paying the highest price. One study found that most hospitals charge uninsured patients.
That's interesting what he just said there. He said that if you're on your own, you pay the highest price. I'm just making sure that's what he
Doctors
said.
on their own. And if you're uninsured, you have even less leverage. Nobody.
If you're uninsured. I'm not so sure about that. That's actually that's an interesting thing because I have been uninsured. For many, many years of my life, I was uninsured. And they will, at least hospitals in my area, will give a different rate that is lower. When it's going through an insurance company, they pretty much, the hospital just gets to charge whatever they want because the insurance company is obligated to pay whatever. Like, it's all such a mess. But they'll be like, oh, okay, like, you're uninsured. We have this separate rate for you. And it's usually lower, not higher. So I'm not sure what the discrepancy there is with my experience and what he's saying.
Nobody is negotiating on your behalf. So you end up paying the highest price. One study found that most hospitals charge uninsured patients 4 times as much as Medicare patients for an ER visit. Other countries, they don't have this problem. Instead of every private insurance company negotiating with every healthcare provider, there's just this big list. Country, the central government, they go and they say, if you want to sell to us, to all of our people, then here's what you can charge for a checkup. Here's what you can charge for an MRI or a prescription for Lipitor. And so then whether that bill goes to the heavily regulated private insurance companies in Germany or directly to the government like in the UK, each country is telling the doctor or hospital or drug company how much that bill will be. And because the government controls access to all of the customers, it's an offer that hospitals and doctors and pharmaceutical companies typically can't refuse.
I love that. It flips the script. You know what I mean? The power is no longer in their hands. Why does this make so much sense?
I'm gonna make him an offer he can't refuse.
In America, the idea is that you'll be a consumer, that you'll do what you do when you go to Best Buy and buy a television. But that just doesn't work in healthcare. It doesn't work in healthcare because you often come and get healthcare when you're unconscious in an ambulance, when you're scared, when it's for your spouse or your child. It is a time when you have the least bargaining power.
Bargaining power. Man, this actually makes me pretty mad. The idea, because what he's saying, I mean, it's true, and I agree with him. I'm getting mad on. It's so true. You know what I mean? It's just so true. The idea of bargaining power in a hospital, like he said, you're unconscious. And these are the highest bills. The highest bills are when you're not even conscious. You've been in a horrible accident. You don't get any bargaining power. It doesn't exist. And also, your insurance company only covers certain hospitals, so you literally don't even get to. Like, you don't even though there's 2 hospitals near me, I don't get to choose which one I go to. The health insurance company tells me which one.
You are not usually capable of saying no. You're not knowledgeable enough to do it, you're not comfortable doing it, or you're not conscious enough to do it. That's why in other countries, the government is a person who can say no for you, who can say, no, that's too expensive, you're gonna have to lower your price, because they do have that power.
A new push for single-payer health care right here in the U.S.
Single payer! Now!
California and others are saying maybe we should adopt the European model.
If we decided to create a single-payer system with one of these huge price lists in the U.S., there'd be nothing to stop lobbying from hospitals, from doctors, from drug companies, and those prices would get influenced. So we could end up with a single-payer system that is expensive, even as expensive as our current system. It all depends on how much you negotiate down the prices. And now in America, these groups have so much power because they are so rich that it's really hard to get them to bring down the prices.
Exactly. Yeah, that's what's scary about it. It's like the whole system is so messed up from the government. Like, okay, yay, the government's paying for the healthcare now, but the government's messed up too. How can we, it seems insurmountable, this issue.
This is the irony of American healthcare. It's so expensive that it's become hard to make it cheaper. all that money they make, that becomes political power. And years and years and years of overpaying, those are huge industries now, and they have a lot of influence in Congress. Under a single-payer system, if we did drive prices down, doctors and hospitals, they would be paid less than they are right now. That might mean some of them close, or some go out of business, or some move. It would be really painful. One person's waste is another person's essential service, or local hospital, or their income. But then single-payer, it's not an...
I feel like while hospital staff is paid pretty well here in America, not all of the staff, but some of the staff, especially like doctors, those are they're paid well. I feel like that's not where the bulk of the money goes. That's just my intuition. I feel like it's not. I feel like it's going to the board members and the people in the suits at the top and the corporate profits. That's how it, which just feels wrong when it comes to healthcare. That just feels wrong.
An all or nothing choice. For instance, there's a really interesting section of Bernie Sanders' Medicare for All bill where he lays out this interim plan. It's a plan he wants while he's setting up his new single-payer system. And in that plan, he expands Medicare to cover vision and dental, and he opens it to nearly everyone, not just people 65 and older. All kids go on Medicare automatically, and most adults can buy in. That plan on its own, it wouldn't get American healthcare spending far down overnight, but it would at least begin to recognize what we already know, and what most other countries already do, that healthcare is one of those things the government can do cheaper and better than the private sector.
Yeah, that's another thing. We don't need to all argue about what would work and what doesn't work. There's so many other countries in the world that already do this. They've already proven they can do it more efficiently. And if you're a true American patriot, you should believe America could do it, take everything, all the lessons learned, and do it even better. It's infuriating. I mean, I was looking at like the cost of health insurance. Oh my God. It's so infuriating, guys. Like if you run your own business or something, if you're not getting your health insurance through your employer, and it's already expensive enough, they take money out of your paycheck, like taxes, to cover your health care. Your employer does typically, if they even offer it. But if you're running your own business or whatever, or you're a contractor, you're paying $1,000 a month to cover your family, or more. To cover your family, $1,000 a month. And then that doesn't even actually cover you. Then you get to go to the hospital, and they don't start covering almost anything up until a certain dollar amount, like $10,000 in medical expenses. Okay. All right. That's it, guys. Thanks to Vox for this video. That was really cool. That was a great video. It's a small and up-and-coming channel, guys. You got to go support Vox. Only 11 million subscribers. Thank you for watching. Subscribe if you want to. I'll see you guys tomorrow. Or next week. Yeah, next week. Goodbye.